welcome to the Comfort Connections podcast. In this episode, Insight for Aging Services Pros, the role of clinical home modifications, we are joined by Katie Dodd. Katie Dodd, Certified Aging in Place Specialist, Principal, and VP of Business Development for LifeWise CHM. Listen in as we discuss the important role of clinical home modifications and how they enhance the quality of life for older adults, promote independence, and contribute to overall well-being. We'll also explore best practices, innovative approaches, and the latest trends in this vital aspect of care. Stay tuned for expert insights and practical tips to elevate your practice in serving the aging population. Welcome, Katie. It's such a pleasure to speak with you today.
Thank you, Tiffany. I'm happy to be here.
Katie, can you share with our listeners the background of LifeWise CHM and services that you provide?
Sure, I'd be happy to. LifeWise was started in 2008, and when we started, we were primarily focused on the private pay market, so folks that were wanting to address their home environments to stay there long term. We found out pretty quickly that people don't really plan much for their homes, that they tend to make changes to it as things happen. For instance, they get diagnosed with a progressive disease or have some type of health event that changes their mobility status. It just didn't happen. There weren't many people having that happen at the same time. We had an opportunity in 2015, Kansas, where we're located, privatized their Medicaid program back in 2015. And we were offered an opportunity to work with the plans to help them manage their home modification benefit. We figured out pretty quickly that we're really good at the management side of the home modification process. And really because we had married the clinical side with the construction side, meaning that we have OTs and PTs who work in tandem with our contractors to make recommendations on what individuals need in order to remain in their home. So we've been doing that now for about 10 years. We are currently in 8 states, still in Kansas, our home state as well. And yeah, that's what we do. And my primary role at LifeWise is really just relationship building, maintaining the relationships with our different payer sources, and really kind of the internal Medicaid guru, if you will.
Thank you, Katie, for sharing your background and about LifeWise CHM. So in thinking of living independently and safely at home, especially as one ages or living with a chronic condition or disability, the terms aging in place and clinical home modifications are rising to the forefront. So Katie, can you explain a little more about each and the impact for older adults and people with disabilities?
Sure. Aging in place means being able to live in a place of your choosing safely and independently without losing your quality of life. Clinical home modifications are home modifications that are done in tandem with a clinician, generally an OT or PT, and contractor. When we evaluate an individual for home modifications, the modifications have a basis in some type of clinical need of the individual. Meaning we look at both the personal, like diagnosis, etc., and the environmental factors that affect this individual's ability to live in the home and make recommendations specific to their needs in order to remain there.
So what is fueling the demand for clinical home modifications, Katie?
The key factors that are driving demand are that people are living longer due to advances in healthcare and technology. Most people want to remain living in their current home when given the choice, and making modifications to an existing home allows people to avoid the high costs associated with institutional or facility-based care.
Can you explain more about how clinical home modifications fit into long-term services and supports programs throughout the country?
Sure. Well, given that my background is now mostly Medicaid, I could really honestly spend all day talking about Medicaid, but I'll be high level and brief on this. So long-term services and supports encompass a broad range of paid medical and personal care services that help individuals with their activities of daily living. So bathing, toileting, dressing, eating. It's generally focused on the aged and disabled populations that are very costly to care for. Currently, Medicaid is the largest payer for these services, while Medicare covers very few of these services. I will say, side note, Medicare is starting to cover more and more, but they live in the supplemental benefit side of things and not in the covered benefit. So the goal of long-term services and supports is to provide beneficiaries with a menu of services that allow them to stay in a place that they're choosing. If they choose to stay in the home, modifications are a critical part of their ability to do so. If the home cannot support basic needs such as bathing and toileting, the ability to remain there lessens as their condition worsens. So quality of life declines, and then as a result, unfavorable outcomes generally follow.
Thank you, Katie, for this overview. You mentioned a little bit of how clinical home modifications help to support so many clients while residing at home. Can you share with our listeners a little more about the impact that you have seen for the clients that you serve?
Sure. Historically, one of the things that we found in doing this work with plans is that as critical as this benefit is for families in order to remain at home, it's often I don't want to call it untapped, but it's not well managed. And when something is not well managed, it doesn't get used very much. And so when we first got into this about 10 years ago, we walked into many situations where, an individual and their family had been waiting months, if not years, to receive a home modification. One of them comes to mind in particular here in Kansas, that this mom that we met, she was a firecracker, nicest lady, and her daughter had been born with several disabilities. She was on a vent. She had a G-tube. She was full total care, the whole nine. And the plan had a contractor come out to do this work for them. And the way they used to do it was they would give half the money up front for the materials, the cost of materials, and then pay the rest of the money at completion. Well, anyway, we got a call from the plan and said, hey, we need your guys' help with this. This is what happened. We went and talked to the mom. Well, the plan paid them half the money, and then the contractor took off, never to be seen or heard from again. So this mom, they happened to be living across the street from a nursing facility, was, in order to shower her daughter, was getting her daughter in her chair, rolling her out the house across the street to go use the shower at the nursing facility for 6 months because this contractor took the money and did not come back, leaving them without a shower. So that's just one example of a lot of the stuff you see happen in this space when you have, those contractors that are more what I like to term as fly by night, or don't know what they're doing, or not used to working with these populations, because a lot of these people are desperate because they've been waiting for something to happen or a service to be provided to them for months and months. And so, nerves and emotions are running a little bit higher than they would be normally. But we've done thousands of these at this point, and we truly get to make a difference in people's lives on a daily basis and see the impact. And, our satisfaction scores speak to those. We generally score over the past 10 years, scored 99% in terms of satisfaction. And, it really makes us all feel good that we're able to help people in a way that impacts their lives positively.
Katie, it must be so rewarding to see the impact that your work has on your clients and their family, as well as their independence.
Yes, it truly is. And, the rewarding part of it not only is with me, but it goes down to the rest of the team that's able to do this work every day.
What are a few key considerations for aging services professionals to support their patients, clients, or residents live as safely and independently as possible at home?
So I would give a consideration to the following points. So functional independence is the first one. So clinical home modifications aim to enhance an individual's functional independence in the home. So by adapting the home environment to suit their needs, individuals can perform activities of daily living easily and with less assistance, fostering a sense of autonomy and empowerment. Nobody really likes, I don't care how old or how young you are, most people don't really like to ask for help. And so having those home modifications really does help with that functional independence. The next one is health and wellness. A home that is not properly adapted to meet the needs of its occupants can contribute to health problems and diminish overall well-being over time. Clinical home modifications can support individuals in managing their health conditions and improving their quality of life by minimizing barriers and promoting comfort and convenience. The next one is facilitation of care. And this really kind of lives more in what you guys do, Tiffany, but for individuals receiving medical care at home, clinical home modifications can facilitate the delivery of care by healthcare professionals and caregivers. So modifications such as wider doorways, low to zero barrier showers, and proper equipment. Now, I can't stress proper enough. Like, there's a lot of equipment out there, and there's a lot of homes that we go into where equipment has been ordered or recommended, and it is not useful for the member at all. So I can't stress enough, before you buy any type of equipment, consult with a professional of some type to help you determine what's going to best work for your needs. And having the proper equipment or proper modifications makes it so much easier for caregivers to assist with tasks like transferring and bathing and getting in and out of the house. The last one, and I think this may be one of the more obvious ones, is the long-term cost savings. Investing in clinical home modifications can lead to long-term cost savings for individuals and the healthcare system. So by preventing accidents and injuries, these modifications may reduce the need for ER visits, hospitalizations, and long-term care services.
Thank you, Katie, for sharing these considerations. They really are spot on to what we see for the clients that we provide services to at ComForCare and at your side. As this episode comes to a close, can you share any further thoughts about the importance of clinical home modifications, especially as one ages?
Sure. While there has been much progress in the health and technology sectors, home building and renovation has remained, in my opinion, relatively stagnant in terms of embracing inclusive design practices. And by inclusive, I simply mean designs that support individuals through all stages in their life. You know, I think back to my mother, who, when they were renovating the home that they're currently in now, she was helping my dad carry some stuff out to the dumpster. She was 40 years old and fell in the dumpster and broke her leg. You know, again, she didn't have any type of disease that prevented her or decreased her mobility, but something happened, and they happened to have a home that supported her ability to get in and out of the shower. So life stages, life accidents, life events, however you want to look at it. But I would really like to see, you know, especially in the building industry and renovation industry, more inclusive design. But unfortunately, most homes were not and continue to not be built with features that support individuals' ability to remain at home should they develop some type of mobility issue, like my mom. So as it stands today, you know, and this is always a kind of sobering statistic to me, less than 4% of U.S. homes are suitable for people with moderate mobility issues, while about 1% are wheelchair accessible. These statistics speak to the importance of individuals and families making the incremental updates needed to remain in a place of their choosing. I always say people don't think about their homes like they do their finances, meaning they don't plan for how they are going to stay in their current home if that is in fact where they wish to stay. So if you start making the incremental changes now, it saves you from having to do it in the midst of a major life change that impacts your mobility and way of living. My mom always said, in a moment, life changes, and that could not be more true.
Katie, we appreciate you sharing this important information for aging services professionals, and thank you for your time today.
Tiffany, you are an amazing host, and I am happy to come back should you ever want to have me back.
Thank you. Listeners, to view resources, show notes, and access more Comfort Connections episodes, visit ComfortConnections.com. You can also subscribe and listen to our podcast on your favorite app. Thank you for listening and helping older adults live their best life possible.